10 body changes you can't ignore that need your attention. Today we're diving deep into 10 alarming body changes that should never be ignored. So stay tuned, because what you're about to learn could potentially save your life. Let's talk about unexplained weight loss. While intentional weight loss through diet and exercise is fantastic, unintentional rapid weight loss without any effort can be a major red flag. We're talking about losing 5% or more of your body weight within 6 to 12 months without trying. Imagine waking up one day and realizing your clothes are fitting looser, but you haven't changed your diet or exercise routine. Unexplained weight loss can be a symptom of various underlying conditions, some of which can be serious. It could indicate anything from hormonal imbalances like hypothyroidism to digestive issues like celiac disease or even certain types of cancer. So pay attention to your body and don't hesitate to seek medical advice if you notice any drastic and unexplained changes in your weight. Let's talk about another common yet often ignored body change: persistent fatigue. We've all experienced tiredness after a long day or a poor night's sleep. But when fatigue becomes a constant companion, lingering for weeks or even months, it's time to pay attention. Persistent fatigue goes beyond just feeling tired. It's an overwhelming exhaustion that disrupts your daily life, making it difficult to concentrate, stay motivated, and even perform simple tasks. Fatigue can be a symptom of numerous underlying conditions. It could be a sign of nutritional deficiencies like iron deficiency, anemia, hormonal imbalances like hypothyroidism, or even mental health conditions like depression and anxiety. Talk to your doctor. They can help determine the root cause of your fatigue and recommend appropriate treatment options. Our skin is the largest organ in our body, and it often reflects our internal health. One of the most concerning skin changes is the development of new moles or changes in existing ones. A mole that changes shape, color, size, or starts to bleed could be a sign of skin cancer, including melanoma, the deadliest form of skin cancer. Remember the ABCDEs of melanoma: asymmetry, border, color, diameter, and evolving. If you notice any of these changes in your moles, it's crucial to see a dermatologist immediately. Early detection is key when it comes to skin cancer. Timely treatment can be life-saving. We all get coughs from time to time, whether it's a common cold or a bout of allergies. But when a cough lingers for weeks on end, it's not something to ignore. A persistent cough, especially one accompanied by other symptoms, could be a sign of something more serious going on in your respiratory system. If you have a cough that lasts for more than 3 weeks, it's generally considered chronic and warrants medical attention. This is especially true if your cough is severe, produces blood or discolored mucus, or is accompanied by other symptoms like chest pain, shortness of breath, wheezing, or unexplained weight loss. A persistent cough could be caused by various factors, including respiratory infections, asthma, GERD, postnasal drip, or medications. Don't ignore a persistent cough. See your doctor to determine the underlying cause and get appropriate treatment. Let's talk about a topic that might make some people uncomfortable, but it's crucial to address changes in bowel habits. Our bowel movements can reveal a lot about our digestive health, and any significant or persistent changes in frequency, consistency, or appearance should never be ignored. If you experience diarrhea or constipation that lasts for more than a few days, it's essential to seek medical advice. Persistent diarrhea can lead to dehydration and electrolyte imbalances if not addressed promptly. Chronic constipation can cause discomfort, bloating, and in severe cases, bowel obstructions. Blood in the stool is never normal and requires immediate medical attention. It could indicate hemorrhoids, anal fissures, inflammatory bowel disease, IBD, or even colorectal cancer. Don't be embarrassed to discuss these changes with your doctor. Pain is our body's way of telling us something is wrong. While occasional aches and pains are a normal part of life, persistent or severe pain that you can't explain should never be ignored. Unexplained pain can manifest in various ways. It could be a sharp, stabbing pain, a dull, aching pain, a burning pain, or a throbbing pain. The location of the pain can also provide clues about its potential cause. For instance, chest pain always warrants immediate medical attention, as it could indicate a heart attack or other serious heart conditions. Abdominal pain could be a sign of digestive issues, appendicitis, or gynecological problems in women. Back pain is often related to muscle strain, but persistent back pain could indicate a herniated disc or other spinal issues. If you're experiencing persistent or severe pain that you can't explain, don't hesitate to see your doctor. They can help determine the cause of your pain and recommend appropriate treatment options. Our vision is precious, and any sudden or gradual changes in our ability to see clearly should never be taken lightly. Here are some vision changes that warrant a visit to your eye doctor. Sudden blurry vision, gradual blurry vision, seeing floaters or flashes of light, double vision and loss of peripheral vision. Sudden blurry vision could be a sign of a detached retina, a medical emergency that requires immediate treatment. Gradual blurry vision might indicate cataracts, age-related macular degeneration, or other eye conditions. Don't wait for vision changes to worsen before seeking help. Early detection and treatment are crucial for preserving your eyesight. Breathing is something we often take for granted, but when you experience shortness of breath, it's a frightening reminder of how vital this simple act is for our survival. Shortness of breath, also known as dyspnea, is the feeling of not being able to get enough air. It can range in severity from mild to severe and can be a symptom of various underlying conditions. Respiratory conditions like asthma, chronic obstructive pulmonary disease, COPD, pneumonia and pulmonary embolism can all cause shortness of breath. Heart conditions such as heart failure, heart attack and arrhythmias can make it difficult for the heart to pump blood effectively, leading to shortness of breath. If you're experiencing sudden or severe shortness of breath, especially if it's accompanied by chest pain, dizziness or fainting, call 911 immediately. Headaches are incredibly common and most of us experience them from time to time. But when headaches become a regular occurrence, lasting for days or even weeks, it's time to pay attention. Persistent headaches, especially those that are severe or accompanied by other symptoms, could signal an underlying medical condition that requires attention. Migraines are intense, throbbing headaches that can last for hours or even days, often accompanied by nausea, vomiting, and sensitivity to light and sound. Cluster headaches are severe, debilitating headaches that occur in clusters, often on one side of the head and around the eye. If you're experiencing persistent or concerning headaches, don't hesitate to see your doctor to rule out any serious underlying conditions and get appropriate treatment. Early intervention can make a significant difference. Our bodies are designed to heal, and bleeding is a natural part of that process. But when bleeding occurs unexpectedly or excessively, it can be a cause for concern. Unusual bleeding can manifest in various ways, and it's essential to recognize the signs and seek medical attention when necessary. Heavy menstrual bleeding, bleeding between periods, and bleeding after menopause are all signs that should be evaluated by a doctor. Blood in the urine could be a sign of a urinary tract infection, kidney stones, or other urinary tract problems. Blood in the stool, as mentioned earlier, is never normal and requires medical attention. Easy bruising or bleeding could be a sign of a bleeding disorder or a side effect of certain medications. If you're experiencing any type of unusual bleeding, don't hesitate to see your doctor to determine the cause and get appropriate care. We've covered a lot of ground today, guys, and I hope you found this information valuable. The key takeaway here is this: if you notice any persistent, unexplained, or concerning changes in your body, don't ignore them. Talk to your doctor. They're your partner in health and can help you determine the cause of your symptoms and get the appropriate treatment.